You don't sing breast songs to your patients?
No, that would not
Let's
be good
talk
for
about
anybody.
breasts, baby.
Yeah.
That would be inappropriate, like kind of awkward if you did that, I guess. Welcome to No Wine and Dine. Is this the best wine you've ever had?
Oh, yeah, absolutely.
It's like, there's a hint of no wine at all. So let's tell everyone why we're not having wine today.
It is true that increasing alcoholic beverages is associated with an increased risk of breast cancer. Everything in life is about moderation. It doesn't mean that women have to stay away from alcoholic beverages completely, so we tell patients to be moderate.
So what inspired you to become a breast surgeon?
I actually became motivated to dedicate my career to breast cancer out of things that I was observing in my practice as a general surgeon. I was noticing that there were such stark differences in terms of the way that breast cancer seemed to afflict my African American breast cancer patients compared to my white American breast cancer patients. My African American breast cancer patients were more likely to be diagnosed with breast cancer at younger ages, and they were more likely to have the cancers that were resistant to treatment. Now we've come to understand that part of the reason why breast cancer mortality rates are higher in the African American community is because of the fact that we have higher rates of a particular type of breast cancer known as triple negative.
I was diagnosed with breast cancer at age 35. My aunt was diagnosed in, I believe, 1998. My mother was diagnosed in 2010, and then my cousin, who was diagnosed 2 years before me, had triple negative, the most aggressive type of breast cancer. She was diagnosed stage 1, cusp 2. They said if they had discovered her cancer 1 year later, she may have been stage 4. When should women get screenings?
Screening mammograms starting at age 40 and continuing yearly thereafter. The rule of thumb that we use is that if a woman has female relatives diagnosed with breast cancer at young ages, she should start getting her mammogram somewhere between 5 and 10 years earlier than the youngest age of breast cancer diagnosis in that family. Breast magnetic resonance imaging, or MRI, is another very good way of evaluating the breast tissue, especially for young women with inherited predisposition for breast cancer.
So when I got my first mammogram, the technician said to me, your breasts are very dense, but they're perky. And I was like, did she just call my boobs stupid but cute?
Young women are supposed to have thick breast tissue because the breast tissue is in its more formative years. As we get older, that dense breast tissue is replaced by fatty tissue. These cancer-associated abnormalities are simply harder to find on the mammogram of a woman with very dense breasts.
So she was not insulting the intelligence of my breasts.
No, it was not nothing
'cause they're
personal
smart.
against
These
your
girls are smart.
the intelligence of your breast. Mammograms are not perfect, and so women do need to be aware of danger signs. Some of the danger signs of breast cancer to be aware of would be the development of a new lump in the breast, the development of a bloody nipple discharge, eczema or dermatitis in the nipple areolar skin of the breast, swelling and redness in the skin of the breast can also be a danger sign. It's perfectly normal for the breast tissue to have some lumpy bumpiness in it. That's just the way the breast is made. The key is to seek medical attention if any of those danger signs develop.
So tell me a little bit about the Know Your Girls campaign that you're doing with Susan G. Komen and Ad Council.
This is a wonderful resource that hopefully your viewing audience will take advantage of at knowyourgirls.org. It's full of important information to empower women about breast health awareness and what we can do to lower our risk of breast cancer and the life-threatening aspects of breast cancer.
And just so everyone knows, these are good girls.
Yeah, there is a very focused information in terms of Know Your Girls for communities that are at higher risk for breast cancer mortality, such as the African American community. Death rates from breast cancer are 40% higher in the African American community compared to the white American community. You will know your own girls better than any doctor seeing you every year. It's important for women to understand how breast cancer is such a treatable disease. Go get your mammograms together as a team of friends, as family members.
And then you can
will
have
do
pineapple
good.
juice afterwards
There you go,
together.
yeah. Your family history is certainly suggestive of some inherited predisposition.
Yeah. But
Now-
we're not BRCA carriers.
Yeah,
Which is
interesting.
interesting. A family friend who's a pancreatic cancer specialist said to us, it's not that you guys don't have a gene link, it's that they haven't discovered the gene yet.
Yeah. I actually, on a screening mammogram, was found to have an abnormality that required a biopsy, and that biopsy did show some findings indicating that I was at higher risk for getting breast cancer in the future. And I actually did opt to have a bilateral mastectomy and reconstruction at the same time. In my situation, I chose the mastectomy for prevention. For some women, choosing a double mastectomy is a decision that a woman will be comfortable with. For other women, continuing with enhanced surveillance and screening with mammograms, seeing their physician for an exam regularly. For those women, that's an appropriate path to take as well.
Should the men in my family be getting breast cancer screenings?
They should certainly be aware of their own breasts and be aware of any new changes, lumps in the breast.
Should I offer to go get a mammogram with my brother?
He should, at a minimum, let his physician know about his family history.
I'm gonna talk to him tonight about his breasts.
That would be a good idea.
Breast episode ever. Cheers to no wine and dine, healthy breasts, and knowing your girl. Oh, did you want to dance?
No.
You won't dance. Will you sing? Is there a breast song that you sing?
In the shower, I'm Beyonce,
Okay.
dancing and singing, but
Okay.
not in public.
We could just make every song into a breast song. Go ahead, give me a
Probably could.
song and I'll breast it for you.
Oh boy, Crazy in Love. Or is that too much Jay-Z?
That's hard. That's
to,
hard. Crazy in
to Crazy in
Love. Give me the lyrics to the first verse.
You're trying to trick me into singing,
No,
aren't you?
I'm not. What's the ring on it? All the single breasts. There. No, that's weird. Get in breastmation. Okay, maybe I'm not good at this game. Now you're just some breast that I used to know. Like a breast touch further. No? Okay, all right.